I'm the director of Queens Borough Council for Social Welfare, which is one of your hosts in the program today. I'd like to thank Borough President, United Way, and NESW for joining us in the planning and implementation of this. And I'd like to thank particularly the Borough President's staff for making so much of this possible. Thank you, Tina. And thank you, Paula, who's not here, but tell her we said thank you when she comes in. She will. We're competing right now with the state new senator. Can't hear me? Okay. I hear me in echo, so it's not over there. Would somebody go into the office across the hall, Audrey perhaps, and I need a flower for Joyce Kettleton, who just snuck in, and I need her up front too, please. I'd like to start by introducing, no, can you hear me now, or shall I wait? Yes. You can, okay, and I will do my best to project. I'd like to start by introducing the dais and the committee members. As I started to say, we're competing with New York State's newest senator, so the Borough President is on the phone with her now. We hope she will be finished and join us at least for a short time. Most years she does stay with us for a considerable amount of time, but we know when we're dealing with someone with her responsibilities that we sort of have to pick and choose. So do we need another chair? No, great. Okay, so in front of us, I also want to say that the choosing the honorees for today was an extremely difficult job shared by the committee. The people who are distinguished between the hard work of a compare the hard work of a social worker in a geriatric center compared to one in a daycare center, compared to one doing outreach with people who are homeless, compared to one working in a psychiatric facility, compared to one in a group home for pregnant young women. I mean, it goes on and on. We're not all doing the same thing. So in some cases, the people who received certificates are doing things that were another year they would have been sitting up here. I think we all as social workers need this month, and particularly today, to celebrate a job well done, and a job that's really needed, and a job that goes without recognition. So I'd like all of the social workers in the room, with awards, without awards, to stand up for a minute, and I'd like us all to give each other a hand. That being said, all of the people on the dais are indeed special people. All have worked very hard and have given to the borough in many, many ways, often for what they're being paid and from their own time. And we will hear more about them later, but I just want to start, I hope I have names correct. Next to me here is Dr. Sarah Sosher from the Birch Early Childhood Center. And Birch, if people don't know it, is a program for people with developmental disabilities. And I think that Sarah works in the early childhood program, particularly with people with autism. So she does some very hard work. She's a leader, she's a teacher, and we are all honored to have her here today. Dr. Lou Levitt is, and I just wonder how many of us in the audience have taken a class with him besides Linda and me. Anybody? Sarah? So you see how his influence, when I said people, oh, someone else over there, when I said people in Queens, he may have said, what did I do? I worked in Washington Heights, but here we are. And next to Dr. Levitt is Dr. Benenson. Dr. Benenson is Vice President of Queens Borough Council for Social Welfare, will be presenting the certificates later on, and is the Executive Director of the Flushing Manor Nursing Homes. And next to Dr. Benenson is Dr. Linda Least, who is the Executive Director of SNAP, Services Now for Older Persons, but has had numerous, which we will hear later, leadership positions in getting services for seniors
not only in Queens but throughout the state. And next to Linda is Harold Eisenberg, who's with the Samuel Field Y, and who will get the Evelyn Pliego Award that we'll hear a little bit about later. And next to him is Christian Carla from Queens Hospital Center, again a major health and services provider in the borough. So our three honorees kind of cover services for young children, services for seniors, and medical social work, all important branches of social work, but again, only representative of the work that we all do, although what wonderful representatives they are. And next to Mr. Carla is Joyce Kevelson, who is the Vice President of QCSW and of SEGS, and again has done some wonderful things for the borough. If you don't know about some of the forensic social work things that they're doing with people who are both chemical abusers and mentally ill and even forensic, you should speak to her before the end of the program and she will bring you up to date, I am very sure. So that's our panel. I wish I could introduce everybody in the audience because I have a feeling we have some very noteworthy people. I'm not going to do that because if I pick on one of you, I will have left out the other one, and we do have a program to start with. I'm going to ask Dr. Levitt if he would not mind beginning. And we kind of have a rule, since the borough president is our hostess in this building, when she comes in, we stop and let her take the time that she needs. It doesn't have to be mid-word, the end of the paragraph. Is that all right? Terrific. Ladies and gentlemen, Dr.
Usually when politicians address audiences like this, they really warm the audience up to tell a few jokes. There's a lot of laughter, and then you can talk. So I have the unfortunate task of starting before that and possibly being interrupted. Now, you know what it is for a professor to be interrupted? Very rare. But as they say, only in America or only in the Queensborough Hall. I'm glad to be here today. It's a wonderful day. We celebrate every year National Social Work Month. And this year it's a special privilege because we're honoring three very beautiful and very able people. I'm going to talk a little bit about social welfare. I'm going to talk about social work. And being a professor, all of you are going to have some homework as a result of my being here. It's not necessary to pick up the yellow paper and pencils now. You can do that a little bit later. First, I want to express my appreciation to the Queensborough Council for Social Welfare for sponsoring this celebration and for the very important work that it does year-round under the direction of a very fine social worker, Joan Serrano-Laufman. That's an applause line. What a wonderful name, a council for social welfare. How fortunate we all are to have an organization whose job it is to bring people together to enhance and improve social welfare. Because social welfare is really the center of what we have all come to call the quality of life. Social welfare, and this is a quote, is the way the production and distribution of resources are organized in any society and in any community in order to improve or maintain the opportunities for individuals or groups to exercise their basic human rights. I was going to say, welcome to Marshall Budjeni, but I will... Okay, thank you. Social welfare affects all of us because we live in an interdependent society. All of us have a great deal to do to enhance and protect social welfare in New York, and indeed in the country as a whole. We need to come together to pool the scant strength that each of us has on our own to deal with all of the forces in our society which seek to undermine social welfare. Take a look at today's Times. We have some interesting news. Our president, quotes, intends next month to propose cuts in programs to provide child care, to prevent child abuse, and to train doctors at children's hospitals. This after a campaign which repeated ad nauseum the slogan, "Don't leave any child behind." This after Governor Thompson, the new Secretary for Health and Human Services, in his initial comments at confirmation, emphasized the need to invest in services for low-income people. Our whole profession, and all of you here, have some homework to do to help to defeat these cuts and to protect the most vulnerable children and families. For the past 100 years in this country, social work has been a leading profession in providing the services and leading the organizations devoted to social welfare. What social work is all about is helping people cope with troubles in their lives that are so dismaying that they can't handle them by themselves, even with the aid of whatever social resources they may have available to them. What social work is all about is helping to prevent those troubles from overwhelming people. And what social work is all about is intervening on behalf of people to change those aspects of the social environment which hurt people, which oppress them, and which inflict social injustice. As I learned more about the careers of the three honorees today, I renewed my conviction that social workers are damn good helping people who are generous with time and energy in working in behalf of others. We take pride in the accomplishments of our clients and value their efforts to help themselves. We're not afraid to take risks in achieving better therapeutic outcomes and better social conditions and policies. Our work is hard because it is only rarely that the resources allocated for the programs in which we are so proudly engaged are sufficient to meet the goals. Our work is harder because the salaries are too damn low and the working conditions produce great stress. I am encouraged by the news that NASW and District 1199 of the Service Employees International Union have joined forces to do something about these sorry facts. In doing this essential work, we and our agencies are witness to myriad patterns of socially induced harm, quite evident in the troubled lives of the people we serve. We continue to become aware of the social conditions which produce the harm. And when we do this, we incur two equally important obligations when we acquire the knowledge. One, our obligation is to help people cope with these troubles in their lives to the best of our ability. Our second obligation is to participate in efforts designed to create a consensus of public opinion that something should be done to change these conditions and materially reduce the harm that they create. I call this the feedback function. When both obligations are fulfilled, as they are every day in the work of the Queensborough Council and in the work of the outstanding professionals we honor today, they represent the best in social work. Feedback works best at a time like this, when the media and public officials are most sensitive and most receptive to the idea that something needs to be done. Did it?
No. I can't see where the volume is.
Volume's too low?
Yeah, we can't hear you on the bad end.
Where's the speaker in the back?
There is none. That's it.
So we turn the lectern around a little bit.
You can do that too.
Okay. How's that? This is a very interesting time we're living through because of the term limits. We're going to get a whole bunch of new people competing with each other for public office. And this represents a great opportunity for people like us. Now, for the homework. If you have yellow paper and pencils, you can take it out. If everybody here would make it their business to contact Senator Clinton and Senator Schumer about the cuts that were announced in the New York Times today and say to them, no way to begin a new administration, no way to enact a budget at a time of surplus, and no way to hurt the most vulnerable children and families. We have some special needs here in New York City. Your experiences may be different than mine, and I rely a great deal and respect the intimacy and immediacy of your experiences. But I want to suggest a few priorities of my own. What matters at the end is that the evidence come forward amidst the call for change, and that it happens in a way in which we share and collaborate with one another. Every social worker here knows of the enormous damage being inflicted by substance abuse. Substance abuse undermines every single aspect of family life. It undermines everything we try to do. There needs to be more drug treatment in prisons and more effective drug treatment in our communities. We need special drug courts manned by specially educated judges, aided by a full staff of social workers. You are a wonderful person. We need drug-free zones around schools and health centers. We need community police presence, working closely with community groups to reduce this despicable commerce. Every social worker knows of the terrible problems of mental illness. Our community-based mental health clinics need to be more adequately staffed. The funding needs to be more adequate and more stable, and the salaries need to be higher. We need to be able to follow patients after discharge and see to it that they have every opportunity to lead the kinds of lives which will not send them back to inpatient treatment in the numbers that exist today. Every social worker knows the terrible problems afflicting individuals and families who do not have health insurance and who do not have enough money to buy necessary prescription drugs. We have to find ways to change the healthcare system at the same time as being the most effective advocates within the system for the many people who need our help navigating their way in these treacherous waters. One of my doctoral students is examining the situation of frail elderly people who need home care assistance, but who have some money which disqualifies them for Medicaid. So the study wants to find out, how do they manage? Indeed, how the hell do they manage? The homework that I'm recommending to each of you is simple and yet quite profound. No matter what the social condition, produce the evidence of harm of which you are aware in your work. Do it collaboratively with the aid of the Queensborough Council and others. Use simple but credible research methods. Get the evidence to the people running for public office and get from them the promise to do something about these problems. If we do this all together, nobody gets shut down. If we do this well, we will be more valued both by the people we serve and by the people who contribute the funds for our services. If we do this right, we will sleep well at night, knowing that despite the inadequate resources, the low salaries, and the difficult working conditions, we contributed to the changes which enhanced social welfare and improved the lives of the people we serve. Thank you all very much.
I'm in a rush. I'm always in a rush. Because Hillary is coming this afternoon to Queens because of the president's desire to cut a lot of the social services in the federal budget. And so apparently she wants to take this up, and she asked if I would join her in doing that, and I said that I would. So I have some remarks here, but I haven't even read them. So. But it's been very, very busy today, and the governor was in town, and he came because we closed the last coal-burning boiler in a school in the borough of Queens. So the governor came, and he said that when he was in college, he earned some money shoveling coal in some factory near where he went to school, and so he showed everybody how he did it. And never having shoveled coal in my life, I did it just as good. But I was very happy to get the governor's ear because we're having a problem with generators on our side of the East River, and I wanted an opportunity to talk to him a little bit about what that really meant to the borough of Queens, because we are now providing the city of New York, this borough is, with 49% of the power. And when they finish upgrading some of those plants on the East River, we will be providing for the entire city of New York 52% of the power. And so I think it's kind of chutzpah for the Power Authority to come into Queens with 2 more generators. So I thought the governor ought to at least know what some of the details are. And I grabbed him for a couple of minutes to talk about that. So Paula said I had to come here. And I love Joan Laufer, and I think she does a great job, and I think that what all of you folks do to deliver services to people that really need those services, I think that's a wonderful thing. And so Paula said, you better come and give Linda Least her award. I'm going to give all 3. Okay. I just finished a meeting, which you might be interested in knowing about. We call it the War Room. And what it is we bring all the education people together in this borough, you know, the district superintendents and the school facilities people and the school construction authority, because we're minus 30,000 seats in public education in the Borough of Queens, because as quickly as we build the seats, that's how many children come in, so we're kind of treading water. But we meet every month, and we discuss every site and every school, and where they are, and where the plans are, and when we're going to put a shovel in the ground, because with this enormous bureaucracy that we live with in the city of New York, if you don't follow these projects on a monthly basis, nothing ever happens. So we have been meeting like this for quite some time, and that's what we just did, and that's why I was a little late coming in here. But this is a, God, we framed it for you. This is a declaration of honor acknowledging Dr. Linda Least on the occasion of being an honoree at the 10th Annual Social Workers Awards reception. Dr. Least has been the Executive Director of Services Now for Adult Persons for more than 15 years and helps to provide a vast array of services to thousands of elderly residents in Eastern Queens. She has served as president of both the Queens Interagency Council on Aging and the New York State Coalition on Aging, and serves as chair of the Action Committee of the Council of Senior Centers and Services of New York City. Dr. Least is revered by her staff and colleagues as both an excellent professional and a beautiful human being. So therefore, I, Claire Shulman, President of the Borough of Queens in the City of New York, do hereby declare March 23rd, the year 2001, is Dr. Linda Least Day in the Borough of Queens. Congratulations. This is a declaration of honor acknowledging Dr. Sarah Sosha on the occasion of being an honoree at the 10th Annual Social Workers Awards reception. Dr. Sosha coordinates the clinical department at the Herbert G. Birch Services, Western Queens Early Childhood Center. Her focus is on the Autistic Spectrum Disorder Program, and through her affiliations with several universities, Dr. Sosha has incorporated social work student interns into the program. Dr. Sosha's outstanding contribution in working with families of children with disabilities and her mentoring of students in the field of social work have earned her this recognition. And we're afraid, Dr. Sosha, you're going to have to share sharing the day with Linda Least. So come on. So what we're doing is that we are declaring March 23rd in the year 2001 as Dr. Sarah Sosha Day in Queens. This is a very big borough, so we can do 3 days in one. This is a declaration of honor acknowledging Christian Calra, MSW, on the occasion of being an honoree at the 10th Annual Social Workers Awards reception. Mr. Calra has been employed at the Queens Hospital Center since 1972 and has been a strong advocate for high-risk women and children. He has extended himself to the people he serves by obtaining services, making placements, advocating for patients, and linking them to appropriate resources. Therefore, I, Claire Shulman, President in the Borough of Queens in the City of New York, do hereby declare March 23rd, the year 2001, as Christian Calra Day in Queens. Now, I have to leave because I do have to meet with Hillary. And if you're driving around, she's going to be on 108th Street.
Thank you so much for coming.
अम्मी तो पैसे डालने गए हैं।
चलो कोई नहीं। तो congratulations to you. All right. I saw her. This is a Gertie guy. Let's get a photo later.
Oh, thank you so much.
You earned it.